Thank you for staying with us. We're here now to talk about pet care. Ivory Hecker has been talking about dressing up our pets for Halloween. I'm going to talk about keeping them healthy. I got to give you a little background situation here. Henry Rothenberg referred me to a facility here in town called South Carolina Veterinary Specialists. I was having some pretty severe problems with my cat that my veterinarian wasn't able to diagnose. So I went over to this facility. I was so impressed. I knew I had to tell our viewers about them, so I invited them here today. I would like you to meet everybody on Woogie Watch. Woogie would be my cat. So Dr. Goldman, thank you for coming today. Dr. Pam Lucas, thanks for your presence as well, and Dr. Hall. Now I'm going to start off, I just want to talk a little bit about this facility because I've learned that pet care has changed so much in the past 15 to 20 years. It used to be you just would go to a veterinarian. Now it seems we have care that is equal to what humans receive as far as specialists. So can any one of you tell me about how that changed and when it came to be?
Goodness, I think it's been in the last, like you said, 15 to 20 years. I think people are seeing pets more as family members, and with that comes higher expectations for their quality of life and the care they receive medically.
And when anyone in your family gets sick, obviously your regular doctor, your GP, is going to refer you to a specialist depending on what your problem may be. Well, that's exactly what they do there at South Carolina Veterinary Specialists. So we began our visit in internal medicine. That's just one of the services that you have. But of course, Dr. Lucas, you're with oncology and cardiology as well. What are some of the other services that are not typical that people mostly don't know exist?
I would say that specialty surgery is another big area where people don't necessarily realize that there are other specialists available. We see patients that are using specialized oncologic doctors, more so than just perhaps medical chemotherapy, but radiation therapy, things along those lines.
And what this means for folks is if your veterinarian tells you get a diagnosis that previously was terminal and very bad news immediately, there's actually hope now. There's treatment available, much like the treatment we get as humans. So quickly, let's talk about oncology and the fact that there's only 200 oncologists for pets worldwide.
Yeah, we're one of the smaller branches of specialty medicine, and yeah, you're exactly right. We're few and far between, which I think a lot of people take for granted. A lot of our clients, not just for oncology, but cardiology, neurology, end up driving quite far distances to get that specialized care.
So I wanted to tell our viewers we're so lucky to have this facility here in town. And Dr. Hall, you're a cardiologist, and I know many animals, if we're lucky enough to have them full term, do end up with heart disease, much like many humans do. So you're actively working on keeping hearts healthy for dogs and cats and pets of all kinds.
Absolutely. We do medical treatment just like people with heart failure get. We're also in the process of trying, hopefully in the next year or two, to set up a laboratory where we can do non-invasive catheterization procedures, things like pacemakers, valvuloplasties, ductal occlusion, where a pet might come in, just stay overnight, have a very small incision, go home the next day. You wouldn't need any open chest or open heart surgery or anything like that.
So the moral of the story is anything that you could do to perhaps keep your family safe, the same is available for your pet. We're going to talk more about that, and I'm going to introduce you to Woogie. We'll talk more about South Carolina Veterinary Specialists and the services that you offer in just a few minutes. We're back right now with Team Woogie Watch. I know you guys didn't know that was what I called you, but it is. Well, here's Woogie, everybody. I'd like to introduce you to, well, this is the love of my life, my little guy, Woogie. Here's the situation. Woogie was losing weight rapidly, and I mean bad. My veterinarian couldn't diagnose him, so I went over to South Carolina Veterinary Specialists, and Dr. Goldman, you work in internal medicine. I handed Woogie over to you first. What did you find?
Well, we did several tests with Woogie because his story was a bit vague and a little bit strange and certainly concerning. And one of our major tests that we did with him after some blood tests, some x-rays, was a minimally invasive procedure that we call endoscopy.
And we have photos of that, those color hole photos. We'll show you some of the images. You guys went in and took some high definition images of the inside of Woogie, and what did we find?
Well, after we acquired some biopsies, you're seeing the inside right now of Woogie's stomach. Actually, that's the scope that you can see, that black long figure there is the scope, and looking at the wall of his intestine and stomach. we acquired some biopsies, and this is a great way to get biopsies of the intestine without having to go to surgery. And unfortunately, what we found was that Woogie had a very low-grade but significant form of cancer of the intestines and stomach.
So that is lymphoma. We got on treatment right away, but when Dr. Goldman realized we were dealing with lymphoma, which is cancer, we went over to Dr. Pam Lucas. So Ms. Lucas, can you tell us, excuse me, Dr. Lucas, tell us what you thought of Woogie, what you looked for, and what you ultimately found?
Well, I mean, the goal with any sort of cancer therapy in pets is really their quality of life. So my goal is really to talk to clients about various treatment options and help them come up with a plan that's going to suit them and their family and their goals.
And I'll tell you this, I was very upset, of course, when I got the news from you. I didn't know how to deal with this, or if I could. You explained not only the condition and what was happening and why he was losing weight, but you got me on treatments right away, including steroids, some antibiotics, and certainly chemotherapy, which was a concern to me. I didn't know we could give animals chemotherapy, so I appreciate that. Let me just move on to one morning. I'm here. Maybe you guys remember a morning when you turned on the show and Tyler Ryan was actually standing and doing the weather for me. That's because I went to the emergency room with Woogie. He had some sort of event. I took him to the emergency services, another service that you have there, and we found another problem with Woogie. Dr. Hall, if you could walk us through that, please.
Well, he presented for some abnormal behavior, having difficulty walking. They transferred to Dr. Lucas because she had last seen him, and then she was suspicious of a blood clot. So she figured, since one of the most common causes for blood clots in cats is heart disease, she had me take a look at him. And what we're looking at here are a couple of images from Woogie's cardiac ultrasound or echocardiography procedure that we did to internally look at his heart muscle, all 4 chambers. But not only that, we looked at, we did some what's called Doppler studies, where we're able to actually estimate pressures within the heart.
So we found out that
Woogie has some unfortunately advanced but still fairly compensated heart disease. And when I say compensated, I mean that his heart is pretty big, but he's not in heart failure. So he doesn't have fluid buildup in the lungs or the body yet, which is very good.
But this is not good news. Both of these conditions are life-threatening, certainly some risks involved, but you guys have me on great treatment, and I have to say, everyone that looks at Woogie, nobody thinks he's sick, because now, thanks to all you fine folks so much over at South Carolina Veterinary Specialists, I intend to have another couple years with Woogie and all the love that he has to offer. So I just wanted folks at home to know that this is available. Not only has pet care advanced exponentially in several years, I mean, you saw those images, those were impressive to me. They quickly diagnosed my cat, quickly got Woogie on treatment, and there's also pet insurance and several ways that you can afford this care for your pet, because I know you want to keep them with you just as long as you can, just like I do my Woogie. Thank you all so much for everything that you do for Woogie and many of the pets here at WACH Fox, actually. We appreciate it. Thanks for coming down this morning.
Thanks, Alexis. It's been
Thanks for
great.
having us.
Thanks.
All right, well, Woogie says thank you too, and we'll be right back with more WACH Fox.